In my 15 years of experience as a urologist and andrologist, I've noticed that many men only start thinking about the prostate when they are already facing some discomfort. As a physician dedicated to men's health, I consider it essential to demystify this very important and often neglected organ. The prostate, a gland roughly the size of a walnut, plays a crucial role in men's health and well-being, going far beyond its reproductive function. During my consultations at the office, I usually start by explaining to patients that the prostate is not just a part of the body we need to monitor after the age of 50. It is a vital organ that significantly contributes to men's quality of life from a young age. Located just below the bladder and surrounding the urethra, the prostate is responsible for producing approximately 30% of the seminal fluid, which is essential for the protection and nourishment of sperm. One of the analogies I often use with my patients is comparing the prostate to a highly specialized production center. Just as a factory needs to keep its machines running regularly to avoid problems, our prostate requires constant attention and care. The prostatic fluid, rich in zinc, citrate, and enzymes, not only nourishes sperm, but also contributes to maintaining the proper pH of the male reproductive system. During my international specialization in sexual medicine, I had the opportunity to extensively study how different cultures approach prostate health. While some societies treat the subject with naturalness, incorporating preventive practices into their routine from an early age, others still maintain a strong stigma around the topic. In the United States, fortunately, I observe a gradual shift in mindset with increasingly younger men seeking information and preventive care. Prostate health is intrinsically linked to a man's overall well-being. During my residency at a leading hospital, I followed several cases that demonstrated how prostate problems can significantly impact quality of life. From changes in urinary function to issues related to sexual life, a healthy prostate is essential for the balance of the male body. A crucial aspect I always emphasize is the importance of self-awareness. Just as women are guided on breast self-exams, men need to develop awareness about their bodies and their functions. Changes in urinary patterns, discomfort in the pelvic region, or alterations in sexual function are signs that should not be ignored. Regular preventive checkups are the best strategy to keep prostate health in check. In my clinical practice, I observe that many men come to the office with inaccurate information or myths about the prostate. Some believe that prostate problems are inevitable with aging, while others fear that any symptom is indicative of serious conditions. It is essential to clarify that although aging may bring natural changes, many conditions are preventable or treatable when identified early. The prostate responds positively to healthy lifestyle habits. A balanced diet, rich in antioxidants, and specific nutrients, regular physical exercise, and good hydration are fundamental pillars for prostate health. During my lectures at medical conferences, I always emphasize how small lifestyle changes can bring significant benefits to the health of this vital organ. Oxidative stress, a natural process of cellular aging, significantly affects prostate health. Scientific studies show that the accumulation of free radicals can contribute to prostate changes. Therefore, adopting habits that combat this process is crucial. In my clinical experience, I guide patients on the importance of a routine that includes adequate sleep, stress management, and regular physical activity. Over the years, I have developed an approach that goes beyond purely medical aspects. I understand that caring for the prostate also involves emotional and cultural dimensions. Many men still feel shame or embarrassment when addressing issues related to intimate health. As a healthcare professional, I consider it essential to create a welcoming and respectful environment where these issues can be openly discussed. As a specialist in men's health, I often encounter expressions of surprise when I discuss the relationship between masturbation and prostate health. It is a topic that, despite its scientific importance, still carries many taboos in our society. However, the medical evidence is clear. Regular masturbation plays a significant role in maintaining prostate health. During my international specialization, I had access to various studies that demonstrate how regular ejaculation, whether through sexual intercourse or masturbation, contributes to prostate health. One of the most important mechanisms is the prevention of congestive prostatitis, a condition that occurs when there is stagnation of prostatic fluid. Regular ejaculation promotes the cleansing of the prostatic ducts, reducing the risk of inflammation and infection. In my clinical practice, I observe that many men are surprised to discover that masturbation can be considered a form of self-care. The act itself promotes the release of endorphins, reduces stress, and contributes to hormonal balance. Additionally, regular ejaculation is associated with lower levels of cortisol, the stress hormone, which at elevated levels can negatively impact prostate health. One of the most interesting discoveries in modern sexual medicine is the relationship between ejaculation frequency and long-term prostate health. Longitudinal studies show that men with a higher frequency of ejaculation throughout their lives have a lower incidence of prostate problems. During my consultations, I often explain that this practice should not be seen solely as a matter of pleasure, but as an integral part of healthcare. It is essential to demystify masturbation and address it in a scientific and professional manner. As a physician, I observe that many patients carry feelings of guilt or shame related to this natural practice. In my lectures for healthcare professionals, I always emphasize the importance of a welcoming and non-judgmental approach when discussing this topic with patients. Conscious masturbation, performed with proper hygiene and without excess, can be considered a form of self-care. During my residency, I participated in research that demonstrated how the regularity of this practice contributes to a better understanding of one's own body and a greater awareness of potential changes that may require medical attention. An important aspect I always discuss with my patients is the relationship between masturbation and hormonal balance. Regular ejaculation helps maintain adequate levels of testosterone, a hormone essential for male health. Additionally, the act itself promotes the release of oxytocin, known as the well-being hormone, which has positive effects on mood and the immune system. In my clinical experience, I observe that men who maintain a healthy relationship with their sexuality, including the practice of masturbation, tend to be more proactive about their overall health. They develop greater body awareness and are more attentive to potential signs and symptoms that may require medical evaluation. Evidence-based medicine shows us that regular ejaculation can be considered a protective factor for prostate health. During my years of practice, I have followed numerous cases that support this relationship. Patients who maintain an active sexual life, including masturbation, generally show better prostate health indicators in routine exams. It is important to emphasize that, like any health practice, masturbation should be done in moderation and with awareness. In my consultations, I advise on the importance of maintaining a regular frequency without excess and always with attention to proper hygiene. The key lies in balance and understanding that this is a natural and beneficial practice for health when done consciously. In my journey as a urologist, I have observed an increasingly clear correlation between modern lifestyle and prostate problems. Prostate inflammation, a condition that affects thousands of men annually, is closely linked to our daily choices. As a specialist in men's health, I consider it essential to share knowledge about how our habits directly impact the health of this vital organ. Oxidative stress, a process I mentioned earlier, is exacerbated by various everyday factors. During my consultations, I often encounter patients who maintain a routine harmful to prostate health without realizing it. Sedentary lifestyles, poor diet, excessive alcohol consumption, and smoking are some of the main culprits that accelerate the inflammatory process in the prostate. An interesting discovery I made during my international specialization was the relationship between sleep quality and prostate health. Studies show that inadequate sleep increases levels of inflammatory markers in the body, directly affecting the prostate. In my clinical practice, I observe that patients with better sleep quality experience fewer episodes of prostate inflammation. The role of diet in prostate health is another crucial aspect that deserves attention. As a researcher in this field, I have been following studies that demonstrate the power of natural antioxidants in combating inflammation. Foods rich in lycopene, such as tomatoes and red guava, are true allies in prostate protection. During my lectures, I always emphasize the importance of a diet rich in colorful fruits, vegetables, and legumes. Regular physical exercise also plays a fundamental role in prostate health. In my clinical experience, I observe that physically active patients have a lower incidence of prostate problems. Regular physical exercise improves blood circulation in the pelvic region, reduces systemic inflammation, and contributes to hormonal balance. An often overlooked aspect is proper hydration. During my residency at a leading hospital, I participated in research that demonstrated how low water intake is linked to a higher risk of prostate issues. Water is essential for the elimination of toxins and the proper functioning of the prostate. Stress management is another crucial factor that directly impacts prostate health. As a physician, I observe that periods of higher stress often coincide with the onset or worsening of prostate symptoms. Relaxation techniques, meditation, and enjoyable activities are important allies in maintaining overall health. A significant discovery in my clinical practice was the relationship between posture and prostate health. Long periods of sitting, common in contemporary lifestyles, can compromise blood circulation in the pelvic region and contribute to prostate problems. I advise my patients on the importance of regular breaks and specific exercises for the area. Temperature is also a relevant factor for prostate health. During my specialization, I studied how excessive heating of the region can negatively impact the prostate. Guiding patients on the proper use of clothing, avoiding direct heat sources, and maintaining an adequate body temperature are important aspects of preventive care. The balance of the immune system is fundamental for prostate health. In my research, I observe how a strengthened immune system contributes to the prevention of prostate inflammation. Adopting habits that strengthen immunity, such as a balanced diet, adequate sleep, and stress management, is a fundamental part of prostate care. As a physician dedicated to men's health, I always emphasize that prevention is the best path to a long and healthy life. Regular monitoring of prostate health should not be seen as a burdensome obligation, but as an act of self-care and self-love. In my years of experience, I have witnessed how preventive care makes all the difference in the prognosis and quality of life of patients. The PSA, prostate-specific antigen test, is one of the main monitoring tools we have. During my residency, I learned to interpret this test not just as an isolated number, but as part of a broader context of the patient's health. It is important to understand that PSA can vary due to various factors, including intense physical activity, inflammation, and even recent ejaculation. One of the practices I adopt in my office is establishing a baseline PSA level for each patient. Tracking variations over time provides much more valuable information than a single isolated measurement. During my consultations, I take the time to explain the meaning of the results in detail, avoiding unnecessary alarms and providing proper guidance when further investigation is needed. The physical prostate exam, performed through a digital rectal exam, is still surrounded by many taboos. As a healthcare professional, I consider it essential to demystify this procedure. In my international experience, I have observed how different cultures approach this exam and have learned techniques to make it as comfortable as possible. The physical exam provides valuable information about the size, consistency, and presence of changes in the prostate that cannot be detected by blood tests alone. The ideal frequency of preventive exams varies according to several factors, including age, family history, and the presence of symptoms. During my lectures at medical conferences, I always emphasize the importance of individualized follow-up. Some patients require more frequent monitoring, while others can follow longer intervals between evaluations. An important aspect of prevention is paying attention to signs and symptoms. As a specialist, I guide my patients on changes that warrant medical attention. Alterations in urinary flow, increased nighttime urination frequency, discomfort in the pelvic region, and changes in sexual function. Early recognition of these signs allows for more effective intervention when necessary. Technology has become an important ally in monitoring prostate health. During my specialization, I was exposed to various advanced diagnostic imaging methods. However, I always emphasize that these tools are complementary and do not replace regular clinical follow-up and the doctor-patient relationship. One of the most rewarding aspects of my clinical practice is observing how regular follow-up transforms men's relationship with their health. Patients who initially showed resistance to preventive exams come to understand their importance and become more engaged in their self-care. This shift in mindset often extends to other aspects of health. Prevention also involves raising awareness about modifiable risk factors. In my consultations, I take the time to discuss how lifestyle changes can positively impact prostate health. Reducing alcohol consumption, quitting smoking, and adopting a healthier diet are examples of changes that make a significant difference. Family support is another crucial element in the prevention process. As a doctor, I observe that patients with family support tend to be more consistent with preventive care. During consultations, I always try to involve family members, when authorized by the patient, in the process of awareness and care. In my experience as a urologist, I have observed how diet plays a fundamental role in prostate health. During my international specialization, I had the opportunity to study different dietary patterns and their impacts on men's health. What I discovered was fascinating. Certain foods can be true allies in protecting and maintaining prostate health. The tomato, for example, is one of the most studied foods when it comes to prostate health. Rich in lycopene, a potent antioxidant, it becomes even more effective when consumed cooked or processed, such as in sauces and extracts. In my clinical practice, I always advise my patients on the importance of regularly including this food in their meals. Interestingly, olive oil enhances the absorption of lycopene, making the traditional Mediterranean combination even more beneficial. Omega-3s, found in cold water fish like salmon, sardines, and tuna, have proven to be excellent allies in reducing prostate inflammation. During my lectures, I often explain how these essential fatty acids work in the body, combating inflammatory processes and strengthening the immune system. The recommendation is to consume omega-3 rich fish at least twice a week. Cruciferous. Vegetables like broccoli, cauliflower, and cabbage deserve special attention. Rich in bioactive compounds such as sulforaphane and indole-3-carbinol, these foods have shown significant protective properties. During my residency research, I followed studies that demonstrated how these compounds can help prevent unwanted cellular changes. Nuts, especially Brazil nuts, are excellent sources of selenium, a mineral essential for prostate health. A single Brazil nut can provide the recommended daily amount of this nutrient. During my consultations, I always emphasize the importance of including a variety of nuts in the diet, reminding that consumption should be moderate due to their high caloric content. The importance of red and purple fruits cannot be overlooked. Blackberries, blueberries, pomegranates, and purple grapes are rich in anthocyanins and other antioxidant compounds that protect prostate cells. In my clinical experience, I observe that patients who regularly consume these fruits show better prostate health indicators. On the other hand, there are foods that should be consumed in moderation or avoided. Excessive red meat, especially when processed or well done, has been associated with a higher risk of prostate issues. During my consultations, I emphasize the importance of limiting red meat consumption and opting for lean cuts prepared in a healthy manner. Excessive consumption of full-fat dairy products also deserves attention. Studies I followed during my specialization suggest that high calcium intake from dairy may impact prostate health. The recommendation is to opt for low-fat versions and maintain moderate consumption. Soy and its derivatives have sparked much debate in the scientific community. In my international experience, I have observed how cultures that traditionally consume soy exhibit different prostate health indicators. The isoflavones present in soy appear to have protective effects, but consumption should be balanced and preferably from minimally processed sources. One aspect I always address with my patients is the importance of proper hydration. In addition to water, teas such as green tea and yerba mate can offer additional benefits due to their antioxidant compounds. During my lectures, I emphasize how proper hydration contributes to the good functioning of the prostate and the urinary system as a whole. As a specialist in men's health, I have increasingly observed the close relationship between mental health, sexuality, and prostate well-being. In my 15 years of experience, it has become clear that we cannot treat prostate health in isolation, ignoring the emotional and psychological aspects that significantly impact men's health as a whole. Chronic stress, so common in our modern society, has a direct impact on prostate health. During my international specialization, I participated in studies that demonstrated how elevated levels of cortisol, the stress hormone, can negatively affect the prostate. In my clinical practice, I often observe how periods of intense emotional stress coincide with the onset or worsening of prostate symptoms. Anxiety related to sexual performance is another factor that deserves special attention. As an andrologist, I notice that many men develop a vicious cycle where excessive worry about sexual performance leads to muscle tension in the pelvic region, potentially contributing to prostate discomfort. During consultations, I dedicate time to address these issues in a welcoming and professional manner, helping patients understand the importance of a healthy relationship with their sexuality. A fundamental aspect I always emphasize is the importance of conscious pleasure. Sexuality, experienced fully and without guilt, contributes not only to mental health, but also to hormonal balance and physical well-being. In my lectures, I share how a satisfying sexual life is associated with better quality of life and longevity, highlighting the importance of breaking taboos and prejudices that still surround this topic. Open communication about sexuality is essential. During my residency at a leading hospital, I observed how patients who were able to openly discuss their sexual concerns had better treatment adherence and outcomes. As a physician, I strive to create a safe environment where these conversations can happen naturally, without judgment or discomfort. The impact of self-esteem on sexual and prostate health cannot be underestimated. In my clinical experience, I noticed that men with better self-esteem tend to be more proactive regarding health care, including preventive exams and lifestyle changes. Self-care and self-love are fundamental to a comprehensive approach to men's health. The practice of enjoyable activities and relaxation techniques has proven to be an important ally. I recommend to my patients the inclusion of practices such as meditation, yoga, or other activities that promote well-being and stress reduction. During my specialization, I studied how these practices can contribute to better blood circulation and relaxation of the pelvic muscles. Social and emotional support is another crucial aspect. Men who have an adequate support network, whether it be family, friends, or support groups, generally adapt better to changes and health-related challenges. In my practice, I encourage participation in discussion groups and sharing experiences, always respecting each individual's time and space. The relationship between sleep and sexual health also deserves attention. During my research, I observed how sleep quality directly impacts hormone levels and consequently sexual and prostate health. I guide my patients on the importance of good sleep hygiene and how to establish routines that promote adequate rest. Lastly, but no less important, I always emphasize that seeking professional help for emotional issues is not a sign of weakness, but of wisdom and self-care. As a physician dedicated to men's health, I have the privilege of witnessing significant transformations in patients who decide to take a holistic approach to their health, including physical, mental, and emotional aspects.